Hi, my name is Dr. Dan Cooper, and I am back with another iteration of Health Hacks. I brought in Madeline Samarin today. She's a Concept 2 employee, because one of the things I hear kind of often, sometimes from patients, a lot of times from other people, that they're afraid of the cervical adjustment. Getting their neck cracked really scares them. Madeline happens to be one of those people. So I thought I'd ask her why that is, what she thinks now, and kind of sort out the situation. So Madeline, it is true you were afraid of cervical adjusting, correct?
Yes.
So what was it about it that scared you?
Well, the biggest thing was that I had heard that just in general, cracking your joints is not good in the long run to do. Like when you crack your knuckles and things, that over time it can degrade the joint and lead to arthritis. So it's just a habit that I didn't want to have and didn't think would be useful in my long-term care of my neck pain.
Okay, and as she mentioned, Madeline is a long-term neck pain sufferer. So I was really happy that she finally decided to use chiropractic services. It's a good point that you bring up though. So I do hear that sometimes too, and I'll address the issue of, am I going to get arthritis if I get adjusted? So there's a big difference between somebody cracking their own joints and some professional who knows what they're doing and is skilled with their adjusting, providing the adjustment. And the difference is this: when somebody just grabs your necks and gives it a crank, what's happening is they're stressing out joint capsules. It's a long, slow pull. And I say it like that because the chiropractic adjustment is specifically not slow, and it's not a long distance that's traveled during the adjustment. It's actually called high velocity, low amplitude, meaning really quick and not a long space that's moved. The thing that happens when you do the long, slow pull is the joint capsule, which is just a bunch of ligaments around the joint. It provides support to the joint and holds in synovial fluid, that liquid that makes the surface nice and slippery. You stress that out. When you stress that out and stretch that out, you've now created a situation where the movement of the joint becomes aberrant. It becomes asymmetrical because there's a little slop in the joint capsule. And if you know anything about arthritis, what that is your body's response to asymmetrical stresses over time. And if you make a sloppy joint capsule, every time you move, you're doing an asymmetrical motion. So that's why if you crack yourself and you don't do it with skill, you're doing very micro damage to the joint capsules. When someone who knows what they're doing does it, there's no damage done at all because we're working within the physiological space of the joint. We're not stressing past that space where the joint wants to move. Makes sense, right?
It does make sense.
So now that you've been adjusted now for a few weeks, are you seeing benefit?
I am, right immediately afterwards, and also over time I'm feeling a lot more mobility in my neck, so I'm kind of hooked now, and understanding the mechanics of it better, that it's a different motion, has helped me relax when I'm getting my adjustment and not be afraid, and then get the benefits of it.
Well, that's great to hear. I appreciate you coming on the show, and thank you.
Thanks.
Until next time.